I just wanted to say that one of the reasons that we wanted to do this hearing is that in the last session, of course, we started very, very quickly, and normally at the beginning of the two-year term, we have a lot of informational presentations just to help people get oriented and understand some of the terms and understand what the state is doing. And I think back to when I was new in the legislature, I had no idea what managed care was. The term PMAP, Prepaid Medical Assistance Program, like who knows what that is? I think most of the public has no idea how we run our public health care programs. And yet we had no time to do anything with that. So I hope that this hearing will fill some of those gaps for folks. But I want to just start, though, by saying that the folks that are presenting today are experts in their fields. They are academics from the University of Minnesota, and we have a very special guest as well from NCSL, which is the National Conference of State Legislatures, who is here as a policy expert on this as well. We're not hearing today from the agency itself. So I just want to put that out there for everyone, that there may be questions for the agency about how things are done, why things are done a certain way, but that's not really what we're doing today. We're really doing more background. And there's certainly, the agency folks have told me they're willing to answer some brief questions if there are some, but that's not really, because there are agency people in the room. But really, this is to get the background and to hear from some of the researchers on the sort of the bigger issues and questions and how managed care works and so on. So I did ask our fiscal folks to, Mr. Berg is here, and I asked him to put together for me just kind of the overview of how much we spend on MA. And because I just wanted to put this in focus, why this is such an important topic. We spend a lot of time on things that are about the smaller money, right? But we spend north of, this is the state share of MA spending, just the state share for 24 and 25 is north of $15 billion, just the state share. And for the out biennium, it's about 18, getting close to $18 billion. So this is a big deal. And that's just the money, not to even speak about the lives we touch. You know, at one point recently, there were about 1.5 million Minnesotans on our medical assistance program. Of course, our Minnesota Care program is much smaller. But so this is about a lot of lives and a lot of state dollars. And so how we deliver these services is just critically important. How we're spending this money and whether we're getting what we should be getting for it is a critical topic for us as policymakers. And yet it's so complex that a lot of times it seems out of reach, and it's really hard for us as policymakers to do the kind of oversight and management of the system that we really ought to be doing.